the quadricep femoris group has 4 muscles in it. Luckily, we know that quad means 4, so that might help us. And I want you to notice that I've tried to color coordinate what's important for you to know, because there is going to be a lot of muscles in this chapter, but again, they're in groups. So first of all, we look at the name of the 4 quads. Then we also want to recognize that one of these is going to be a rock star. We've had them in other chapters. So our first one up is rectus femoris. He is the rock star because he is the most superficial and he crosses 2 joints, the hip and the knee. You can look at the bottom and see that I have it circled, rectus femoris. Origin and insertion are listed here, so it's the AIIS, or anterior inferior iliac spine. The next one in the paragraph, vastus intermedius, because it is deep to rectus femoris. So when you look at the bottom right-hand picture, it's showing you what vastus intermedius looks like, but it's directly beneath rectus femoris. Then we have, back up in the paragraph, vastus medialis. So probably you could guess that it's on the medial aspect of the upper leg. And it is completely opposite of vastus lateralis, the only muscle that is on the lateral thigh. I'm going to repeat that. Vastus lateralis is the only muscle that is on your lateral thigh. Remember that when we get to the end of this chapter. So also, we can look in the paragraph and see that vastus lateralis has an edge that lies between bicep femoris, which is one of our hamstrings that we haven't talked about yet, but we will, and also it's going to meet back up with the edge of rectus femoris. Okay, so on that lateral aspect of the thigh. Also, we would need to circle that vastus lateralis is deep to the iliotibial tract, also known as the IT band. And yes, we are going to talk about that with lots of eye-opening moments. I want you to know that as a group, they all come together to insert into one exact spot below the patella or below the tibiofemoral joint into the tibial tuberosity. And if you look at the picture, we have the patella, then we have tibial tuberosity. So it's the bump below the patella. I have circled here the all fire action. They extend the knee. All of them do, all 4 quads. And rectus femoris, because it also has to have an action at the hip because it crosses 2 joints, is also going to flex the hip. But again, we'll focus in on all of the actions at the end, but this will help you just get started with becoming familiar with where these muscles are. Page 307, just notice the views so that you don't get confused. Medial, lateral, posterior. Still looking at quads. You don't necessarily need to memorize the exact origins, but you do need to remember that rectus femoris is up on the pelvis. The other ones are on the femur. Here's the right side view, but they all insert into that same spot. I do want you to notice that on the right-hand view of page 308, this is a posterior view, and look at where these quad muscles are. We do think about them as being only anterior on the front of my thigh, but if you turn back to this bottom of 307, look, you can see, you're going to be able to feel some of those. So that is our 4 quad muscles. There is other pages. Feel free to view them for your understanding. The workbook will also help. Page 311, to go to the opposite side of the femur to our hamstrings. So we have 3 hamstrings. Here's our name, bicep femoris, semitendinosus, semimembranosus. They're explained on the next page as far as origin and insertion and individual actions, so we will look at that. I just want to look as a whole at what we have going on here in the paragraph. So these are on the posterior thigh. Notice it says they're between vastus lateralis, which is on the lateral aspect of the thigh, and adductor magnus. So it's an adductor muscle we haven't talked about yet, but that's over here. So these are sandwiched between there. These are very strong hip extensors and knee flexors. This is very important, and we will talk in class about why the hamstrings are historically and most commonly a lot of the issues that people are having in their upper extremity based on the tension in all of the hamstrings. You can see here we have the bicep femoris, and notice they're lateral. The two semimembranoses or semi-muscles are on the medial aspect. So this at the top, bicep femoris lateral, medial hamstring are the two semis. So if you remember they're medial and lateral, that will help you with their actions as well. So on the bottom of 311, they're both, one lays right on top of the other, and they have a lateral insertion. Keep that thought process. Let's just look at the medial insertion of the two semis, the top of 312. So medial. And yes, one is deep, one is more superficial, which I want to look at the two semis and see what I have written here. Semitendinosus has a T, so it's on top. It's also a little thinner or skinnier. Semimembranosus is a little wider and it's deep. So that might help keep track of who lays on top of whom in this particular picture. Bicep femoris, notice that I have written here that bicep femoris is an antagonist to the two semis because bicep femoris is lateral and the two semis are medial. So we want to keep that in mind. We'll focus in on all of the actions at the end, but notice here in the center I have the all fire action, so that will help you. On the bottom of 312, I just want you to look at the origin. So we're talking about they originate here. This is the short head of biceps, so they do all attach at this ischium or ischiotuberosity area, and then they insert below the knee, which would help you know that they're all going to have an action at the knee. At the very bottom, I have written for your future that these are an antagonist to the quadriceps, or the muscles on the front of the femur are going to be an antagonistic action with the muscles on the back of your femur. Kind of makes sense for that. I just want you to note on page 314 this particular position and how we can tell the difference between vastus lateralis and bicep femoris. We are going to do this in our class lab time, and you will absolutely love it as a way to tell the difference. It will also help cement where these muscles are on our femur also. So that was 4 quads, 3 hamstrings, and now we're going to go to page 315 for the gluteals. So again, underlining or highlighting what I have written here, there is 3 gluteal muscles, gluteus maximus, gluteus medius, and gluteus minimus. Gluteus minimus is on the next page, so we're not going to be able to see that here, but we do need to get these things highlighted, things written on this page. We're going to start with gluteus maximus, being the largest, most posterior and superficial. Notice this is our gluteal fold, gluteal cleft, just to review some of those terms. I also want you to notice that the fibers are diagonal. And then I also want you to look very closely, and it tells us here in the origin and insertion, but we have 2 separate insertion sites. One is to the back of the femur, the other is to the iliotibial tract. So the glutes can cause tension in the muscle that the iliotibial tract is laying upon. And again, we'll get to iliotibial tract or that IT band later. So for the separate gluteus maximus, notice there's all fibers and then lower fibers. Then we'll move on to gluteus medius on the lateral side of the hip. So we have this one here. It is superficial, but there is a portion that is laying underneath gluteus maximus, so it's deep to gluteus maximus. But both of these together are strong extensors and adductors of the hip. That's important. Also, what I have written at the top that I have at the very bottom of the page, we'll look at all of the all-fire actions, but this group as a whole is an antagonist to the adductors, which no, we haven't talked about them yet, but we will be. Then we're going to just underline or highlight the information about gluteus minimus. It is deep to medius. It has dense fibers that sometimes can be felt. It is partially inaccessible, but there is a certain action that maybe we can feel it. All depends on how defined it is. Because it attaches to the anterior surface of the greater trochanter, so the front of what we can feel on our lateral thigh, gluteus minimus flexes and medially rotate the hip, which means it's an opposite or an antagonistic action to maximus. So now we have glutes that are fighting each other. Yay! As well as the adductors. On the bottom of page 315, so here's gluteus medius. We've cut away maximus. So you can see, as we talked about in the top part, it is on the lateral aspect of this iliac crest. It does have a superficial portion, but there is also this anterior portion and a posterior portion. The all-fire action, when all three gluteals and all things are working, is to abduct the hip. If I asked you to separate your femurs, that is abducting the hip. Abducting the hip. So just because we just looked at all that stuff in the paragraph, here's gluteus minimus on the top of page 316. Notice it's below gluteus medius, which then is deep from gluteus maximus. They have identified right in the front here another one, tensor fasciae latae. We haven't talked about that muscle yet, but we will. But you just need to know where this is. 316 on the right hand side. So just to see that black and white or black and red of the origin and insertion. So how these three gluteal muscles are inserting into the lateral and posterior aspects of the femur. The one view that I want you to know about, and we'll do this in class time, page 318, for this helps us isolate gluteus medius and maybe minimus, it just depends. So it's just when we do that abduction, that abduction, so somebody can be in the sideline position, they could be supine, they could be prone, it works all of them. This just has historically a little bit of gravity that is helping, because the other aspects that are laying on top of this muscle might gravitationally deviate a little bit, so that'll help us discern those gluteus medius and maybe minimus muscles. Now on to the adductors, and we've mentioned that we have the adductors. So this is page 319. We'll get to this in just a moment. I want us to focus in on the names. So three of them, it's easy to know that they're part of the adductor group because they say adductor. And then we have pectineus and gracilis. So all five are on the medial thigh between the hamstrings and the quadricep femoris group. Yay, now we know where they're located. We can think of this as being like the inner groin. So when people might say, or you hear, I strained my inner groin muscle, probably it's one of these, but technically it could be some other ones. It all depends on specifically which one they're talking about. So together, the tendons from these five extend down, or they all come together at the same spot It is by the ischial tuberosity. So just because I want us to look at that, here's the bottom of the page, so I just want you to notice, see how they're all formed together here. Another view here, okay? Back up to the top. I've tried to kind of give a little color coding here. The muscle bellies of the adductors lay in 3 layers. So now we're going to separate them out. So the first 2 layers are pectineus and adductor longus. These are the 2 most anterior. So pectineus and adductor longus. The next layer, the next layer is adductor brevis here. And then we have the one that is more on the posterior aspect, adductor magnus. We're going to look at another view of magnus on the next page. It'll show how big it is. And then we have the very last one, gracialis. So this one is the most superficial at the medial thigh and the only adductor that crosses the knee. So this one would be the rock star of the group. What I have written here is important. You need to know shortest to longest, which technically is also, if we look at the medial femur, it's medial out to the edge, which would be our actual medial thigh. So you could say medial femur over to medial thigh. So they are shortest to longest, pectineus, adductor brevis, adductor longus, adductor magnus, and then gracialis, who is the longest. The other thing that I want you to notice about the group, they have 2 all-fire actions. We're going to break down the muscles here shortly. And then at the very bottom, the same thing that I said about the when we talked about the gluteals, this whole group is an antagonist to the gluteals. So the inner groin or the inner thigh muscles are fighting the glutes. On page 320, I want you to focus in at the bottom. Here's adductor magnus. So again, how big it is attaching to the ischial tuberosity area or the ischium and the whole almost back of that femur. At the top, pectineus, adductor longus, adductor brevis. They're also showing us gracialis. On the next page, the top of 321, here is your black and red, or black and white, that's how I always like to think of it, of the breakdown of where these originate and insert. But notice the bottom, there's your specifics, which you do not need to focus in on. More so just have the idea that they're all in the same area. Gracialis over here, I wrote that you could think of that as your inseam. Page 283 would give you the specifics if you want to look at just a separate view of the femur. Sometimes that helps students, so totally up to you. A good visual is what is on page 322 for these adductor muscles. So we can see where they're located in general. On the bottom of 322, again, where they're located. But also, because adductor magnus is so big, this is a position that we will talk about of a way to work with adductor magnus. And we'll do this during our lab time. And here's a little box that talks about that. But I want you to be able to feel the difference when you are on adductor magnus muscle versus the other muscles that are listed there. Next, we have one muscle and then the all-important iliotibial tract, or the IT band. Page 324. We're going to start with the muscle, which here is our origin and insertion of the muscle. Okay, so tensor fasciae latae, or TFL, is very small. We can see it on this left-hand view here. It's in the upper thigh area, or you could say the front of your hip. It's approximately 2 or 3 fingers wide. This says 3, depends on the size of your fingers, right? But the TFL you can feel, and it is between the upper fibers of rectus femoris. So remember what group that muscle is in? And gluteus medius. You should be able to remember what group that one's in. The TFL attaches to the iliotibial tract along with gluteus maximus. So when you look at this left-hand picture, so we're talking about all of this white stuff. Here's gluteus maximus, and then it blends down in. So let's focus in on the iliotibial tract, also known as, in the orange there, the IT band. Superficial sheet of fascia with vertical fibers that run along the lateral thigh. It's fascia, connective tissue. If you go on further to what I have circled, the fibers of TFL and some of the fibers of gluteus maximus that are blending into the iliotibial tract or this fascia are similar to the thick matted texture of packing tape. Doesn't stretch. I know that's a thought process, but it does not stretch. It is a strong stabilizer of the hip and knee. So historically, when people think that they have knee problems, they're like, oh, my IT band is tight. However, it's the muscle that's underneath it, vastus lateralis. So I also have highlighted here in blue the gluteal fascia, which is posterior of tensor fascia latae. This is also fascia that's at the very top of the longer fascia. We will focus on how to discern the difference between TFL and this gluteal fascia and gluteus medius. And then we'll focus on what we can do with this tension on the lateral aspect of the thigh. As far as the actions of TFL, I want you to focus in, but also write down that when we flex our hip, we are shortening these fibers. So if you have people or yourself that sit a lot, or you could be in an anterior tilt, you're going to be shortening this guy, which is going to cause a lot of tension. And then the insertion is opposite of pes anserinus. Hopefully you have focused in on that a little bit. We did look at that at the very beginning. Page 352 is where you can see this site, but it's just opposite of that, just for us to remember that. The other thing that I want to focus in on TFL is on page 325, and they're just showing how maybe this could be an action that you could feel TFL. This would be a passive action, or it could be an active one or resisted. So you could ask the client to do that. It depends on what you're doing in that situation. We are getting down there towards the bottom of these list of muscles. Page 326, here's that reference to pes anserinus. Sartorius, at the very top, the longest muscle in the body. It goes from the anterior superior iliac spine down to and across the medial knee. It is superficial. Here is all of the actions of this. So there's 5 of them. And then notice I have circled that little picture of the guy, or I guess, I don't know if it's a guy, it's a person, it's a human that is maybe knitting or doing something in their lap, because this is called the Taylor position, or you could call it figure 4. All 5 actions of Sartorius have to make that happen. So you can see in this bottom picture, you could do this when you were supine, you could do this when you're prone, or you could do it when you're sitting in the chair, right? But all 5 actions are what has to happen in order to get into this position. So again, ASIS down to this pes anserinus attachment site, which is below the knee. Again, page 352 to look at that. We will talk about the actions again here shortly. Lateral rotators on page 328. And then I think we just have a couple muscles left after this. What I want you to notice is this first paragraph. These deep 6 muscles, I bet they all do lateral rotation, right? Because it says it, that's what they do. There is 6 of them. They are deep to gluteus maximus, and they create lateral rotation of the hip, which be to do that lateral rotation of our femur. That's what we're talking about. And all of them attach to the greater trochanter and fan medially to attach to the sacrum and the pelvis, which is how we create that lateral rotation. So here's a picture of all of them being deep to the gluteals. Notice this big yellow sciatic nerve coming out of there. And then notice what I have written or circled here about piriformis. This is our sciatica or piriformis syndrome or sciatic pain, whatever you want to say. The piriformis lies superficial to the sciatic nerve and if overcontracted can compress it. We mentioned that when we talked about the sciatic nerve itself. Here's piriformis individually, but I do need to do one little thing. We're going to have to look at how to identify piriformis. Everything about piriformis you need to know. Origin, insertion, and actions. This is page 330 with how you can locate piriformis. It is important. We will be doing this during class so that you will be comfortable. Your communication is key and your professionalism because it's coccyx, posterior superior iliac spine, and the greater trochanter, which is exactly where your person's piriformis is going to be located. Yes, you might do this little action to make it happen, but sometimes it's not best to move the client just because of the pain or what they're experiencing. So back to page 328, origin, anterior surface of the sacrum, insertion, superior aspect of the greater trochanter, which would be the top of the greater trochanter. You need to know these. As far as the actions, I bet this group has an all-fire action to laterally rotate, and piriformis is going to have one more, because of course it's the rock star of the group. It is also going to abduct the hip when the hip is flexed. And we'll focus more on that in the actions here shortly. I want you to write in here that abduction with the hip flex will lengthen the fibers, which means they can be thought process of stretched out or telescope out further. But if someone has lateral rotation of their femur as part of how they walk or with their posture, piriformis is absolutely going to be pushing down on that sciatic notch. And then keep in mind we have the gluteals on top. The other 5 of the 6 lateral rotators, and I'm just showing you a big that I have aware. I want you to be aware that there's 6 of them. You don't have to focus in on the names. The workbook will take you through that. That will be sufficient enough for that. But everything about piriformis you do need to know. Origin, insertion, actions, the T, how to locate piriformis, extremely important. I know you guys can probably see this in your book, but on the bottom of 329, just want to point out just the origin and insertions of these muscles, all 6 of them. And so you can see how they can create that lateral rotation or to rotate that femur laterally. On the next couple pages, there is some other views of ways that you could try to work with some of these muscles. Again, the workbook will also take you through some of those exercises. And then we are down to the last 2 muscles before our actions. So this is page 332. Technically it's 2 muscles, but we can put them together into one term. So separately we have psoas major and iliacus. There is a psoas minor, but only a certain amount of population have it. So we're just going to focus on psoas major. When we put those 2 together, they're the iliopsoas. And together these 2 muscles are hip flexors and low back stabilizers. A stabilizer means that it's meant to have tension in it to hold things together. Yes, you could say that these 2 muscles are going to have tension in them, but again, they're made with the stability thought process, or they're created for that. I did highlight that they are also known as the tenderloin or the filet mignon, because I've had several students that have like, oh, I've heard of that. So this, just remembering where these muscles are might help. Both of these are located in the same area. Psoas major, which is the longer one, stretches from the lumbar vertebrae. This muscle is deep to the inguinal ligament, which is going from the ASIS to the pubic tubercle, and then it goes and attaches or inserts into the lesser trochanter. The iliacus inserts into the same spot, but this is on that iliac fossa, or the anterior portion of our hip. So again, they insert to the same area, so they are going to have similar actions. So those are the ones that I have highlighted. They both flex the hip, they both flex the trunk towards the thigh, and they both tilt our pelvis anteriorly. I do want you to notice that they may laterally rotate the hip, and when that happens, it shortens the fibers. So it just depends on what that posture is of your client or the person that you're assessing. Separately on the bottom of 332 here, you can see how they have iliacus, they have psoas major, so just so you can see the difference. On the top of the next page, 333, we have just that black and red, or the simple origin and insertion, same site, lesser trochanter, which is directly opposite but inferior of the greater trochanter. Notice what I have written here. I don't know a specific technique that is going to lessen the stability of these two muscles, but there is a technique that we can unwind the iliopsoas with ease. It's easy on me as therapist, but also I promise you that when you practice this technique, the client will feel the difference, even if they didn't even know that it had tension or excess tension in it. So we'll do that during class. Here's the psoas minor that I was talking about, 40% of the population. So it's hard to say who has it, who doesn't, but it is there. That is the last of our muscles, but I have one more quick view because there is a lot of techniques out there in the world as manual therapists. Whether it's for physical therapy, occupational therapy, massage therapy, I've seen this in all different avenues. So you have a person laying in the supine position, and you're digging in and having them maybe bend their knee, or you're passively doing it in order to try to find where the iliopsoas is located. As you can imagine, we have a lot of abdominal contents, some more than others, but we still have all that stuff going on. I'm not exactly sure how you're going to be able to get perfectly to that. The bottom picture is a little easier, so I just wanted to put this in because we want gravity to help us. So this is a sideline position that if you are able to move the abdominal contents out of the way, which maybe gravity will help in this sideline position, that you might be able to do that. I'm saying might, because we will do this in class and you will see what it feels like, and then you're going to make the decision on your own of what you want to do with that particular technique. So now we're going to go backwards in the book, in the pages, so we can get to all of the actions. Again, keep in mind you can pause, you can come back to this later, you can make note of where it is so that you can come back and study these on your own. Page 302, couple things I want you to focus in on. These first several are for the coaxial or the hip joint. So we are talking about moving the femur, okay? This is not involving the tibial-femoral joint. Notice that I have 8 to do flexion. So this is to kick a ball, right? So we're going to bring my femur forward. You can have that thought process. And notice that I have the assist, 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 assist. And because those are the adductors. So visually we can see where these are. If we think flexion is bringing my femur forward, all of these muscles are going to be on the front or the anterior portion of the femur. Psoas major we just got done talking about, so that's the one that goes from the lumbar to the lesser trochanter. Iliacus going from that iliac fossa, oh, I guess they're pictured over here, sorry, to that lesser trochanter. We have tensor fascia latae, the little one that's right on the anterior portion of our pelvis. Sartorius, that longest muscle of the body, has a little S shape to it for sartorius. It's going to do that talar position. So this, we have to bring our leg forward to make that happen. And then we have rectus femoris being one of our quads. So that one's here. The hardest ones to think about is how can we have gluteus medius anterior fibers and gluteus minimus, which by the way they do everything together, but how can that have an action to bring our femur forward? Because they attach to the greater trochanter. So knowing where the muscle lays will tell you the actions. The adductors are on that inner thigh area, but they are sisters. Extension is the opposite movement. So this is where I'm going to walk up to somebody, grab hold of their pant leg on the back, and pull their femur back. This is extension. 6 of them, but look, we have 3 hamstrings, and that's half the battle. So the hamstrings are on the back of the leg. They're going to pull that femur back. We also think of gluteus maximus. It's on the back. So all of the fibers are going to be helping to pull that femur back. And then we have gluteus medius, also posterior fibers on the back. So there's 5 of them that are on the back. The hardest one perhaps to remember is adductor magnus, but if we remember where it is, it's on the back part of the leg. It's pictured here on this left view, a little harder to see, but adductor magnus is more posterior, so that's why it's pulling the femur back in extension. The top of page 303, we have medial rotation, still talking about the hip, also known as internal rotation. And oh my gosh, yes, there's a ton of them, right? But if we remember our groups, this will help. 2 gluteal muscles, medius and minimus, because they do everything together. 5 adductors, so we have the 3 terms that have adductor in it. You just have to remember the other 2, pectineus and gracilis. 2 of the hamstrings. Which 2 are on the medial aspect? The semis. So the 2 semis are medial. So that's our 2 hamstrings. And then we have TFL on the anterior portion, but it is also attaching to that femur. So it's going to do that medial or internal rotation. So when we break it down that way, definitely a lot easier. The same we'll do on this bottom picture. We have lateral rotation or external rotation. Again, we're talking about the femur. How do we move the femur? I bet all 6 of the lateral rotators are going to do lateral rotation. Then we have gluteus maximus, all fibers. So it's on the back side, on the lateral aspect for insertion, so it's going to do that lateral rotation. Then we have gluteus medius, also posterior, so it's going to do that lateral rotation because of the insertion. The harder ones to think about, psoas major and iliacus. Why do you think that they would do lateral or external rotation? You have to think about what they're attaching to. Over here, lesser trochanter. So when they fire or contract, they're going to be doing that lateral rotation. We also have sartorius, so the long S, because that's part of that talar or figure 4 position. And then we have one more on the bottom here. Bicep femoris is an assister, and it's just one of the heads. Bicep femoris is on the lateral aspect of our posterior femur, so of course it's going to do that lateral rotation. Hopefully, this is making sense just based on where the muscle is located. Page 304 at the top, still talking about the hip, we have abduction. So this would be separating your feet, but technically we're talking about our femurs. So it's taking your femurs apart. If you are sitting or standing, where are your femurs? Are they in neutral, or are they abducted or adducted? All right, just as a thought. So when we look at our list, we have 6 of them to take this femur and move it out. If you remember that an all-fire action of the glutes is abduction, that's 3 out of the 6. Then we have tensor fasciae latae, which was also when that muscle is going to be bringing that leg out. Sartorius, because of course it does 5 things. So there's our big long sartorius. And then piriformis is got a little notation to it. Piriformis could be engaged if the hip is flexed. So if you're sitting and your femurs are apart, your hip is flexed, you're using your piriformis. So you could be sitting and not having your femurs apart, so then it would not involve your piriformis. So it just depends on the position that you're sitting in. The bottom picture is a little, you have to look at the arrows, but basically I'm asking you to bring your femurs together. Adduction, we're adding them back together. Easy to think that, hey, I bet all of the adductors do that. We have a total of 6, 5 of them are the adductors, and then gluteus maximus, but just the lower fibers, because this gluteus maximus attaches to that tensor fasciae latae, but then also the back of the femur. So our gluteus maximus lower fibers are engaged when we have to bring those femurs together. One or both, just as an action. Now we get to switch gears for the tibiofemoral joint or the knee joint. Pay attention to what I have here so that we make sure we're all on the same thought process. We're first going to do flexion of our tibiofemoral or our knee joint, which is bringing your heel up to your glutes or bending your knee. There's our action. Notice I have the line because these bottom 3 are in chapter 7. I want you to focus on the 5 out of this chapter that are making this happen for the chapter test. So in order to bend our knee, we would have to think of which one's attached below the knee. That's going to be half of the battle. And if we also look at these top 3, they're all hamstrings, because that's an all-fire action of the hamstrings, is to bend my knee. Then I have gracialis, which is the longest of the adductor group. It crosses 2 joints, so it's going to do something at the knee. And then sartorius, because of course it's that long, big, long muscle. So it also, we have to bend our knee to do that figure 4 or that Taylor position. The opposite is extension. Very simple for extension, which would be bringing our knee forward or like kicking the ball. It's the all-fire action of the quads. Done. Easy. And then our very last action, or 2 actions I should say, medial rotation of the flexed knee and lateral rotation of the flexed knee, which is different than flexion and extension. The important thing for you to remember is this has to do with where the muscles are attaching or inserting. So lateral rotation of the flexed knee is easiest because we have that one hamstring that is attached on the lateral side, so it's going to laterally rotate my flexed knee. So if you're sitting and you pull that knee out away from the other knee, lateral rotation of the flexed knee, bicep femoris. The opposite would be medial rotation of the flexed knee. Notice that I have 4 written here because Popliteus is in chapter 7. If you remember that the pes anserinus attachment site is on the medial knee, then you remember the three that attach there, semitendinosus, sartorius, and gracilis. And then the two semis are also on the medial aspect of the knee, so they're also going to do medial rotation. Hopefully what I've created for you will help you make sense of all of these muscles, but just as an overview, and where we're going to end this very long lecture, is page 276. This is all of the things that you want to be able to identify visually, know the areas, know the terms, but also, just as a reminder, we have gluteal fold and gluteal cleft, two terms that you want to make sure that you know. So all of those muscles are creating all of that topographical area.